So something that I've seen is a little controversial, specifically, as a matter of fact, a few years ago during one of the Real Truth About Health panels, there was T. Colin Campbell and I think a couple of the plant-based doctors and Dr. Kim Williams, and they were talking about stents and statins.
Yeah.
Everyone was saying that they don't affect the endpoints, right? They don't. The only endpoint that we really care about, which is mortality. And Dr. Williams said, no, they actually do. They do,
Yeah.
lower the chance. So what? Yeah, I wanted to hear your opinion on that.
Yeah. So the deal with statins is, of course, it's kind of cheating in some senses, right? And that's why people who are in the pure lifestyle medicine world, you're like, hey, eat 100% plant-based, get your LDL down that way, stop the inflammation that way, and then you won't need the statins, right? But you know what? A lot of people don't do the diet, and they don't do it. And if they're eating foods that are high in cholesterol and saturated fat and pro-inflammatory, statins can knock the inflammation down and knock the cholesterol numbers down. They can be effective. Now, the reason, of course, there's some side effects. They say anywhere between 5 and 20% of people could get muscle aches. But overall, the mortality is significantly reduced. You saw the clinical trials I showed with that little line and the dots. Almost every single secondary prevention trial, which means you've already had a heart attack or stroke, you've already had a blockage, an aneurysm. Statins have been shown to reduce mortality and events. Now, that's because these are sick people, they're higher risk. You'll need to wait 2 or 3 years to see the benefit. Primary prevention trials, healthy people who've never had a heart attack or stroke or a blockage, to see the effect of a statin is going to take decades, right? Like I said, the sooner you get your LDL down in life, the better you're going to be. So if I have a 30-year-old person who comes to me and says, Doc, I eat McDonald's every day, I'm not stopping, I don't care, I weigh 300 pounds, but I'm not changing my diet, I can't get them no matter, I get on my hands and knees and I beg them and give them all their nothing, won't change their diet, their LDL is high. If I put that person on a statin and drop their LDL from 150 down to 50, over 20, 30, 40 years, it's going to have a marked reduction in risk of heart attack and stroke and clogging arteries if they continue their unhealthy lifestyle habits. But how do you measure that in a clinical trial? You don't do clinical trials for 30 years, right? These clinical trials are usually at most, a few years. And so that's why the primary prevention data is lacking because it's not long-term enough. But certainly there is a benefit in the long term. Now, I am definitely somebody who pushes lifestyle first. And some other doctors get nervous. Somebody will come in, their LDL will be 150, and they want to throw them on medications right away. And I said, well, do you want to try a lifestyle approach? And if they say yes, I don't give them the statin. I give them an order for fasting lipid profiles every month, and I educate them. I give them resources, or you have a local nutritionist who does all the plant-based stuff, everything they can. But then I say to the guy, hey, listen, or the gal, you've already had a heart attack or a stroke or a blockage, man. This is super important to get this controlled. If you can't do it through diet after you check this once a month for the next 3 months, we got to do something to get your number down. And I don't want to give the medication, but it is still helpful. And there's other things out there too. There's a bunch of newer ones for praluent and everything. But I am still very much so trying to avoid it. But the reality is we're not there yet to where we can get everybody to just, boom, plant-based diet and get their numbers down. I sure hope that day comes, but I do advocate statins whenever we need to. Even Esselstyn will put people on statins. If they're eating whole food, plant-based, oil-free, and their LDL is still 80 or 90, despite that, if they have real severe disease, he'll tell them to take a low dose just to get the LDL down to at least that less than 70 range. So it does work. It's just harder to tease out the data, and the side effects annoy people, of course, if it's there. But in general, it can be important. It's an important tool, but nice to try to avoid. And many people just choose not to. And that's okay, as long as they understand the risks and benefits.
Okay, I'm going to ask another question in the audience, but I want to ask you one quick question that's sort of similar. But if you can just keep it short, which is stents. Do they prevent death in the long term of a person?
Yeah, so I touched on that a little bit early in the presentation. And the answer is, in stable people who are not having heart attacks, no, they don't prevent heart attacks in the future. They don't make people live longer. During an active heart attack, when an artery is clogged and clotted off, a stent can be life-saving in that instance. But otherwise, no, lifestyle is way more powerful than stenting in stable disease. And there's a risk of complications, heart attack, stroke, and such from doing stents or bypasses. So we really, it's been taken off pretty good, where we've been really avoiding over stenting people nowadays. It's slowly catching up, but there's so much money in it. They make so much money doing stents. It's a slow process.
Great. Susan, you're up next. Please state your name, where you're from, and your question.
Hello, my name is Susan Frankel. I am from Chicago, and I loved your presentation. It was fabulous. and home of Dr. Williams.
Yeah.
So my question is focused on the role of exercise. So I am a 69-year-old female, 5'5", 112 pounds. I've been on a whole food, plant-based diet, salt, oil, sugar-free, close to between Esselstyn and McDougall diet. Back in February, I fractured my foot dancing. I normally dance 12 hours a week. I am a very active person. But since February, I've been unable to exercise and I've been wearing a boot. So flash forward 2 months to my annual lipid blood work came back. 2 months later, my LDL went way up. My triglycerides went up. I mean, it's still under, but it's not below 70. And could the lack of exercise be the cause of this? Because my diet is perfect.
Thank you.
Yeah, well, it's a great question. And so a couple of different things. I'll talk about exercise in general real quick, and then talk about your specific situation. Maybe I'll do your situation first. If you gained weight because of lack of exercise, that will increase your LDL. Exercise in general reduces triglycerides and raises HDL. So lack of exercise will increase your triglycerides and will lower your HDL. So we do know that. So certainly, yes, the lack of exercise will impact those things. And if you gained weight, the biggest impact of exercise on LDL is more with the weight. There's only a small percentage of people where pure exercise alone, independent of weight gain or loss, that exercise alone will lower your LDL cholesterol. Most of LDL lowering is dietary, not exercise induced. But if you exercise and it helps you to lose weight, simple weight loss has been shown, even if it's just through exercise, to knock your LDL down. So I think, when you have an orthopedic injury, most Americans who aren't eating as good as you are, I tell them it's even more important when you break your ankle or something that if you're not exercising, you got to be even more strict with diet, because you're going to gain weight if you continue your same diet and not being physically active. But in your situation, since your diet is already so perfect, I would try to advocate doing anything else you can to stay active. There is actually arm ergometry machines where you take your arms and you pedal with your arms. You got to ease into it so you don't hurt your rotator cuffs or something, but there's other alternative ways to exercise, whether it's in the pool or whatever. Try your best to stay as active as you can. The general recommendation for exercise, which again, in the presentation said maybe 20% of heart health is exercise, most of it's food, but you want 30 to 60 minutes a day, 5 days out of the week of moderate intensity aerobic exercise. So 2 days you could rest, 5 days, you want 30 to 60 minutes, moderate intensity aerobic exercise, and then also 2 days of strength training. Now, it's a little controversial as to whether or not doing more exercise than that is good for your heart or not, like marathon running, like I do. There's a lot of research that shows marathon running actually calcifies your coronary arteries. But when the plaque hardens, is that the type of plaque that really increases heart attack risk and such? Well, there's not a lot of good way to answer that question, but there's anecdotal stories like 2 marathon runners having cardiac arrest right in front of you during your half marathon. So you never know what's going to happen. Both those runners have run marathons and they're very well trained, fit athletes. So probably the sweet spot is right there, 30 to 60 minutes a day, 5 days out of the week of moderate intensity. You can cut the minutes in half and make it vigorous intensity if you want, but also throw some resistance training, not big, heavy stuff. You don't need to squat 300 pounds and bench press like crazy, but simple strength training as well is very helpful.